Hyperthyroidism. What is hyperthyroidism? We know for a fact that hyper means a lot or too much, and thyroid here refers to the thyroid hormone. So hyperthyroidism means the excessive synthesis of thyroid hormones. In this presentation, we will be taking a look at the normal physiology of the thyroid hormone synthesis system. We will also be looking at the causes of hyperthyroidism, the symptoms of a person having this disease, how we diagnose a person with hyperthyroidism, and how do we actually treat it. Greetings to all, my name is Lim, and today with MengWei, we are going to be taking a look at hyperthyroidism in this video. Before we delve into hyperthyroidism, let's take a look at the secretion of thyroid hormones under a normal balanced system. The synthesis of thyroid hormone begins when the hypothalamus secretes a thyrotropin releasing hormone to the anterior pituitary gland via the hypophyseal portal system. This causes the anterior pituitary gland to secrete thyroid stimulating hormones, TSH, into the circulation where this TSH arrives at the thyroid gland. Upon binding to the TSH receptor, thyroid stimulating hormone causes the follicular cells, contained in structures known as follicles, to synthesize thyroid hormones. The thyroid hormones include triiodothyronine, T3, and thyroxine, T4. These thyroid hormone will then travel to other tissue via the circulatory system, and usually they increase the metabolic rate of those tissues. When there is too much T3 and T4, they exert a negative effect on the hypothalamus and anterior pituitary, suppressing the release of thyrotropin releasing hormone and thyroid stimulating hormone. This leads to a decrease in T3 and T4 release. Hyperthyroidism is actually caused by a lot of factors that disrupts the homeostasis of the process we mentioned just now. The most common cause of hyperthyroidism is Graves' disease, which contributes up to 80% of the hyperthyroidism cases. Graves' disease is an autoimmune disease, which means that the body produces antibody against its own cell. The plasma cell of the patient produces TSH receptor immunoglobulin or autoantibody. This autoantibody binds to the TSH receptor on the follicular cell, mimicking the effect of TSH binding and causes synthesis of T3 and T4, as if TSH really binds to the receptor. This causes an increase in T3 and T4 in the circulation. However, it is interesting to note that despite the increase in concentration of T3 and T4, they cannot suppress the release of more thyroid hormone, since the receptors are not stimulated by TSH but rather those antibodies. Besides, during pregnancy, HCG or human chorionic gonadotropin can bind to the TSH receptor and stimulate the follicular cells to synthesize thyroid hormone. This is why sometimes pregnant women shows mild symptoms of hyperthyroidism. This is also known as HCG-associated hyperthyroidism.
The third cause of hypothyroidism is Toy's multimodular greater. This is caused by a mutation in the TSH receptor. A mutation in the TSH receptor allows the activation of the thyroid synthesis pathway by the receptor even when nothing binds to the receptor. This causes continuous synthesis of T3 and T4 in the absence of TSH. Meanwhile, in Toy's thyroid adenoma, a benign tumor of the thyroid gland keeps the synthesis of thyroid hormones on. This also leads to hypothyroidism. In pituitary adenoma, a tumor in the pituitary gland increases the secretion of thyrotropin releasing hormones. As you may remember, this will cause increase in TSH release. This will then increase the release of thyroid hormones from the thyroid gland. Next, we will take a look at the symptoms experienced by patients with hypothyroidism. Patients may have an increase in sympathy activities, such as rapid heartbeat, irregular heartbeat, excess sweating, anxiety, nervous, and irritability. Besides, patients also have increased basal metabolic rate. This is usually shown as weight loss, even though their appetite may increase. This is because the body has a higher than normal energy demand. Patients will also have an increased sensitivity to heat, and they also sweat a lot. This is because BMR is increased and the thermogenesis process occurs at a high rate.
Other symptoms may include brittle hair, fatigue, and muscle weakness. If the cause is Graves' disease, Graves' ophthalmopathy may follow. This is characterized by the bulging of the eye, the increase in visible area of the white of the eye sclera, and blurring. This may lead to vision problem.
There are a few common tests used to diagnose if the patient has hypothyroidism. These include blood test, thyroid ultrasound, and thyroid scan of radial dye uptake. First, a blood test can be done. In the blood test, the thyroid-stimulating hormone and the thyroid hormone level in the serum are measured. Thyroid hormones will be higher than normal in the blood of patients with hypothyroidism. High T3 and T4 usually means a problem that organogenesis from the thyroid gland, while high TSH implies a problem anterior pituitary, such as a pituitary adenoma.
Secondly, thyroid ultrasound can also be done to detect structural abnormalities in the thyroid gland. For example, whether it is due to a tumor in the thyroid gland.
Lastly, radioactive iodine uptake test and cytosol scan can be used. By the injection of labeled iodine uptake by the cytosol gland can be checked. If the cytosol gland is overproduced cytosol hormones, the damage of iodine will be high. Radioactive iodine will be accumulated in the cytosol gland faster than normal.
To treat hyperthyroidism, we can either administer drug, use radioiodine therapy, or perform thyroidectomy. Drugs such as beta blockers can be used to block the beta-adrenergic receptor via inhibition to decrease sympathetic activity, hence the name. Anti-thyroid drugs such as methimazole and propylthiouracil can inhibit thyroid peroxidase, an enzyme that is involved in the thyroid hormone synthesis. However, do note that anti-thyroid drugs can be very harmful to the liver. Radioiodine therapy can be done by injecting radioactive iodine, which will decay spontaneously in the body. When this radioiodine is taken up by the thyroid gland, the decaying process of the iodine releases energy that is enough to ionize and destroy tissues in the thyroid gland. Oftentimes, despite being able to solve hyperthyroidism, patients experience hypothyroidism after the treatment, which is the lack of thyroid hormone synthesis. Thyroidectomy is a surgery performed to completely or partially remove the thyroid gland of a patient. This is done for those who refuse or cannot take radioiodine therapy, such as in pregnant mothers. The removal of thyroid gland is often considered a last resort, as it may also cause many side effects, such as the disruption of calcium homeostasis if the parathyroid gland is removed altogether. Patients will also need to depend on medication to supply thyroid hormones to the body afterwards. That's all from us. We hope that you learned something from this video and most importantly that you enjoyed this video. Thank you.